Okay, welcome everyone on behalf of Benefit Express. Thank you for joining us this afternoon for our ACA reporting webinar for self-insured employers. So I just wanted to reiterate that this presentation is tailored by Larry Rugine, our ERISA attorney, for self-insured. So if you're an insured, you can watch. We did that webinar 2 weeks ago, and that is posted on our website at benefitexpress.info. Under the archived webinars page. I will also send that to you in the chat box so everyone has that. I did send the slides out this morning along with the forms, so I hope you received that. If not, they're also in the handouts tab of your GoToWebinar toolbar for your reference during the presentation. Our next webinar is in 2 weeks. It's Tuesday, March 15th at 1 p.m. Central Standard Time, and it's Administering Health and Welfare Plans, Common Compliance Questions. And Larry, I'll have Larry touch on it, but it's brand new information, so that's going to be something everyone's going to want to join in on.
Yeah, we've done this seminar for the past 2-3 years, and this year 95% of the areas and the questions are different. It's based on questions I'm getting from my clients, so they're pertinent to your practice. And what we're doing in this seminar is going through COBRA, HIPAA, healthcare reform, all the various common questions that I've been getting. And this is also, anytime I have a question, it generates probably 2 or 3 other questions from the audience. So again, this is a good way of getting a good review of all areas of health and welfare. Like I said, ERISA, COBRA, HIPAA, HSAs, HRAs, healthcare reform. So it's a good overview, and it's based on a question and answer basis. So it's very interactive. I think you're going to find it very enlightening. Okay?
That's great. And then just a reminder, we have a high number of participants today, so I'm going to go ahead and keep everyone on mute. Larry will pause for questions throughout the presentation, and then if you don't feel comfortable verbally asking your question, or if it's easier, you can ask it through the questions tab on your GoToWebinar toolbar, and I'm happy to find the answer out for you. So Larry, I'll hand it over to you.
Thank you very much. This area is real hot right now because the first forms, the 1095-Cs, have to be provided to the employees by the end of March. So it's end of this month, you have to give them to your employees. And then depending on the size of how many you've been filing the 1095s, if you file 250 or more, you have to do it electronically. But by the end of May, you have to file it on paper. The end of June, electronically. Now, generally, when I do these seminars, what I first do is go through the form itself, and then I drill down even deeper. So let's go through, see what the 1095-C looks like, see what it is. Bear with me a second here's the 1095-C. As an introduction, what I like to do is go through the form, and then I will pick apart each section later. Now, first question comes up, who do you have to give a 1095-C for? This is a very common question I've been getting. Do you give a 1095-C to every employee, only those eligible for coverage? Who do you give it to? And the instructions say you give it to any employee that's been full-time for a month, and full-time is defined as 130 hours or more. Now, this is reported on a calendar year basis, January through, so it's everybody's in it, so no matter what your policy year is, everything is reported on a calendar year basis. And every full-time employee gets a copy. So in Part 1, it's the individual's name, Social Security number, street address, their personal information goes there, and that's the employee. The applicable large employer is you, the employer. Now, if you're a company and you have 3 different divisions, and each division has their own separate EIN, each separate division should file their own 1095-C that employs that particular individual. So please understand that. So member means it is the individual member of your control group. So again, if you have 3 different separate members of your control group, each one will file a 1095-C for their employees. And that's the name of the employer, a street address, all the information has to go there. And then part two is the employer offer of coverage. Now, you have to put in, enter when your plan year starts. So it starts in May, it'd be 05. And then in line 14 is the offer of coverage. During 2015, for those months, when you offer that individual coverage. And when I go through it over the next few minutes, what I'm going to do is tell you the popular codes that you should be considering. So, did you offer coverage? If you did offer coverage, there's one code. If you did offer coverage, depending on who you offered coverage to, was it offered to the entire family or just the employee? There's different codes for that, and I will go through each code. Line 15 is the employee share of lowest cost premium. Now, it's not the program, it's not the coverage that they actually took. It's the lowest cost option you provided them. So if you offered three programs, three plans, they pick the most expensive plan, you don't report that. You report the lowest cost, and it's for individual coverage only. So it's the employee share of the lowest cost monthly premium for individual coverage. And this is going to be an important figure. Now, line 16 is the most complicated. There's a number of different situations that are reported in line 16. And I will go through each one of those situations. Now, if you're an employer that has full-time employees and people generally take your plan, you want to look at the first column and lines 14, 15, and 16. So if somebody is covered for all 12 months or the offer of coverage for all 12 months, that's the only thing you fill out is the first column. What's going to be complicated and difficult are for those of you who have a lot of variable hour employees or a lot of turnover, because it could be a situation where you have 2 or 3 codes in each row. So that's what makes it complicated to complete the form. Moving on to part 3 is the individual. And again, because you're self-insured, you have to complete part 3. Every individual covered, including the employee, has to be listed there, and for what months they were covered under the plan. So again, you have to check the box. If an employer provides self-insured coverage, check the box and enter the information for each covered individual. So again, if you're covering the whole family, and it would be the husband and wife and the 3 kids, if those that are covered, and you have to indicate for what months they were offered. Now you'll notice there that you have to put the individual's name, Social Security number, and if you can't get the Social Security number, the date of birth. So again, there are certain employees that may object to giving the Social Security number. You at least have to ask if they have one, and then if they don't, you have to ask for the date of birth. So they provide enough boxes there and enough lines. It goes on and on. So again, this is going to has to be provided to employees by the end of March of this year. So that's when they have to be provided. Stacy, do you have any questions in the initial?
I do have just one. It says, in a COBRA situation, what amount is shown on line 15?
It's not.
Okay. So no, it says, if a former eligible employee's COBRA cost plus 2%, is it that?
No, nothing is. The only time you have to list that is for employees, not for COBRA participants. Remember, and this is important, this form is important for a couple of purposes. One is for the individual mandate, and that's where Part 3 comes in. It's also important for the employer mandate. And because there's no employer mandate for COBRA participants, because it's not considered an employer plan, you don't have to fill out line 15.
Okay, perfect. Okay, that's the only question I had. Let me unmute.
Why don't we open up real quick in case, I don't want people to get lost, so why don't we open up, anybody have any questions in the beginning when we open it up?
Hold on, I'm having trouble. It's not unmuting. 1 second. Hold on, Larry.
Mm-hmm.
All right, let me try this again. First, there's a first for everything here. Okay, let me try this. Hold on.
The conference has been unmuted.
Cool.
Okay.
Does anybody have any questions?
I have a question. This is Lynetta from Chicago Public Schools.
Mm-hmm.
And, well, one, I just want to make sure I'm clear on what you just said about COBRA, because we have COBRA participants. We do not have to put a dollar amount in online.
No, and why don't we, for those of you who are interested in COBRA, I have slides just on that.
Oh, okay.
Yeah, so I will be covering that, and I know it's a burning question, but remember, now, because you have self-insured coverage,
Rick, I don't know why that's
you have to complete Part 3. And there's a code that goes into line 14. It's 1G, and that has to be indicated they're a non-employee. So, again, I'll be covering that in the next few minutes.
Okay.
Anybody have any other questions?
I have another one. I'm sorry.
No problem.
So our deductions are on a percentage basis, so we don't do a flat fee. In box 15, we have to put the dollar amount. Our lowest cost is 1.3%. So we'll put the dollar amount for the so say for Lynetta, she makes $90,000 a year. Is 1.3% of that is what she would have paid.
Well,
not that she elected.
Right, and it's based on single coverage, and remember, the affordability safe harbors are based on either the rate of pay, W-2, or the federal poverty line.
Right, so everyone, we cap it at 90. Anyone that makes over 90, they pay the same amount. So every individual would have a different amount in that box because they make a different amount.
You are correct on that.
Okay.
You can do it that way, or you can take the lowest paid employee, take 9.56% of that, and do that way.
Oh, we can. Okay.
Yeah. So as long as you can do it either way, you can be individual, or you can do it according to the lowest paid person.
And take 9.5% of the lowest cost,
right.
The lowest paid person.
Right.
Okay, that was it. Thank you so much.
No problem. Any other questions? Anybody else?
Okay, I'm going to go ahead. I'm just having to manually do this. So, Larry, give me like an extra minute here until you hear me say okay to start talking again.
Okay, no problem.
Well, I have a question.
The conference has been muted. The conference has been unmuted.
I'm sorry, you had
Sorry, go ahead. I was in the process of muting. Go ahead, though, with your question.
Oh, sorry. About the retirees, I just sent it also under the questions chat. We have retirees under 65 and over 65. Do we have to provide an amount in question number 15?
Not for the retirees, no. Not for the retirees.
But we have to supply this notice to them.
You have to give it to them.
Okay.
You have to give them a form, but you don't have to complete line 15. For anyone who is a non-employee who's covered by your plan, you do have to provide a 1095-C, but you don't have to fill in, and I will be talking about that in the next few minutes. Part 2, there's only certain sections you have to fill out.
Great. Thank you very much.
Sure. Anybody have any other questions? Okay.
Yeah, I have a
Yeah, go ahead.
Yeah, so you mentioned it could be individual or lowest paid person. I'm just curious to know, is it fine if we did the rates based on each individual employee?
The rate of pay, sure. If some people make $10 an hour, other people make $11 an hour, sure, you can do it that way. Now remember, For 2015, instead of using 9.5, you can use 9.56, which will create a little bit higher number, and that increases to 9.66 in 2016. Okay?
Yep, thank you.
All right, why don't we mute people right now?
Okay.
The conference has been muted. The conference has been unmuted.
All right, I think our phone communicator is having some issues because I have to manually do everything through the phone, so I cannot just unmute Larry. So if everyone could just keep us on mute on your end, that would be wonderful. And then we'll let you know when it's time for questions, or it might just be easier if you ask your questions through the questions tab today. I apologize, everyone. I've never had this issue before in 2 years, so I'm assuming it's an error on level 3 communications part. But Larry, why don't you go ahead?
Okay. Now, again, determining whether an employer is an applicable large employer for 2015 is determined in 2014. An employer can use either the calendar year or any consecutive 6-month period. And as I indicated in the beginning, you have to provide a 1095-C form for any employee who is full-time for a month in 2015. Now, full-time is defined as 130 hours or more. Now, if you have a variable hour employee, and if they're full-time for a month, it doesn't mean they're full-time. They're not full-time, a variable hour employee, until they complete their measurement period and their administrative period, and they're in their stability period. That's when variable hour employees will be considered to be full-time. That's going to be an important distinction. So, and again, an employer that provides health coverage through an employer-sponsored program must complete 1095-C Parts 1 and 3 for any employee who enrolls in health coverage. And for any full-time employee, you have to complete Part 2. Now, there's special, again, coding in Part 2 for any individual who's a non-employee, and that is indicated in the last bullet on this slide. If and for all 12 months of the employee is not a full-time employee, the employer must complete only Part 2, line 14, by entering 1G. So that includes any retiree, any COBRA participant. You don't have to complete lines 15 or 16. You put 1G in line 14 and then complete Part 3. Please understand. So again, in the year after they terminate employment, they're on COBRA. It's a very simple way of completing the form. You just use code 1G in line 14. Now, again, the form 1095-C must be provided by March 31st, and then they must be filed with the Internal Revenue Service. If it's filed on paper, it has to be filed with the IRS by the end of May, and then it has to be filed. If you have to file electronically, it has to be filed by June 30th. So paper has to be done by May 31st. Electronically has to be done by June 30th. So by the end of this month, you have to provide them to your employees, or any other individual has to get a copy. So employers must furnish a 1095-C as applicable to the person identified as a responsible person. Statements must be furnished by mail unless the recipient, which is the individual, consents to receive statements electronically. So what I'm trying to say here, you can't automatically send them electronically. You have to get the employee's permission or the COBRA participant's permission. Now, this slide is extremely important because it explains if you're a member of a control group, which means that your employer owns other businesses, and each other business have a separate EIN. each separate member with a separate EIN must file forms under their own EIN. If an employee works for more than one ELE member, they will receive a separate Form 1095-C for each member, but you can only get one 1095-C per month from just one member. So they have to decide for what months that individual will be reported on the other 1095-C. Now let's look at the form. In Part 1, lines 1 through 6 indicate the name, address, and Social Security number of the employee offered coverage. Line 7 through 13, that's where you're, as an employer, the separate ALE member is reported. And line 10 indicate the telephone number of the person that the employee participant can call if he or she has any questions. Very simple. Now, this is where it gets complicated in Part 2. This is line 14. Enter the applicable code for the offer of coverage. If the offer of coverage is for the entire calendar year, place the code in the first column. Now, the code must be entered for each month, January through, even if the employee was not a full-time for one or more months. So you have to put a code in there for each month. And enter the code identifying the type of health coverage actually offered to the employer by the employer or on behalf of the employer to any employee. Now, here's the codes. 1A. 1A is only used if you, as an employer, offer coverage. The offer of coverage is called a qualifying offer, and a qualifying offer means that the employee does not pay more than 9.5% or 9.56% of the mainline single poverty line, which is currently $11,770. So in that situation, if an employee pays less than $93 or $94 a month, you can use this code. And this code is extremely important because if you use 1A, you don't have to complete line 15. So if your employees pay less than $93 or $94 a month, you can use 1A. 1B, if you have minimal essential coverage providing minimum value offered to the employee only. 1C, minimum essential coverage providing minimum value to the employee and dependents, not the spouse. 1D, you offer minimum essential coverage providing minimum value to the employee and a minimum essential coverage offered to the spouse, not the dependents. And 1E is you offer it to the dependents and the spouse. Now,
visiting nurse provides end-of-life care for our patients.
Somebody put us on hold.
Families.
I know, I apologize.
Patients
For some
and
reason our
families,
communications
services
company
at
is
home,
having issues and I have to manually
have
do it through the
expertise
phone, which is
and
all or nothing basically.
of an illness
I
while
apologize,
tending
everyone.
patients' quality of life.
Let me try
Our
again.
staff includes physicians certified in hospice and palliative care, nurses, social workers, counselors,
Unfortunately, it's
and a
completely
multi-denominational
frozen.
staff.
I'm locked out,
Care.
so I can't mute that person.
Services are available 24 hours a day.
You can't
7
mute
days
anybody?
a week.
Nope. I have to do
Yep.
it all.
I just told the person
Oh,
it's
thank
getting
you.
off. Sorry.
Thank you. It's okay. I apologize for all this inconvenience today, everyone. Thanks for being patient.
Okay, all right, now, what's important here is that, and this was important, if you offer coverage to a single individual, but as a practice you offer it to the entire family, okay, in this situation, you still can use 1E. Now, 1A and 1E are extremely important because the fact that if you use 1E, you're not going to be penalized. You're also not going to be penalized if you also use 1C. That's coverage to the dependents and not the spouse, okay? So again, those are important codes that you want to use in this situation. Those are extremely important codes. So 1A, 1C, or 1E, if you use any other code, it's going to be you're going to be penalized. Now, let's look at some other codes. 1F, if you offer an MEC plan that's not minimum value, you have to use 1F. 1G, if the offer of coverage was not a full-time employee, again, that 1G applies in a situation where it's a COBRA participant. okay, or a retiree. And another important code is 1H. 1H is no offer of coverage. If somebody wasn't working for you, okay, then you have to use 1H, or they're in a waiting period or in a measurement period, and no offer of coverage was made. 1H is going to be extremely important. So those are the codes. Now, again, if you're just offering an MEC plan, it's not minimum value. Another important code is 1F. Now, one other code that I think nobody is going to use is 1I, qualifying offer transition relief. And in this situation, this is an employee, spouse, or dependents was offered a qualifying offer some months and not for others. I don't see anybody using that code. Okay? Now, line 15, if you're using 1B, 1C, 1D, or 1E, in this situation, you have to, again, what you have to do is you have to put a dollar amount in there. If employees are not paying anything, you put 0 in there. If the amount is the same for all 12 months, the amount is entered in the first column and do not complete the monthly boxes. If the employer does not offer health coverage or is offered health coverage that is not minimum value, you don't complete line 15. Okay? Extremely important to understand. Now, line 16, as I indicated before, there's a number of different situations that are reported in line 16. Whether someone's working, whether someone took the coverage. You also have to indicate if somebody waived coverage, what the safe harbor codes are. And there could be a situation where more than one code will apply for the year. Now, these are the situations that are reported in line 16. Whether the employee was not employed or was not a full-time employee, whether they're enrolled in minimal essential coverage, whether that employee was in a limited non-assessment period, which is a waiting period, or in a measurement period, whether the non-calendar year transitional relief applies. I will explain what that is in the next few minutes. Whether that employment, one of the safe harbors. And again, those safe harbor codes only apply if somebody waives coverage. Now, if you have union employees, I'm going to discuss that. If you have union employees, there's a special code in line 16 that applies for that. That's 1E. And that code only applies if that coverage is affordable minimum value coverage. And for any month you contribute for that employee, there's a code for that, and I'll be explaining that in the next few minutes. Let's look at the codes. 2A. Circle that. That's an important code because if anybody hasn't worked for you for that month, for example, you hire somebody in April of 2015. For January, February, and March, it's going to be code 2A. Okay? 2B, if that person is not full-time, and they were covered by your plan, it's 2B. 2C is an extremely important code. 2C extremely important. It applies for any month that person was covered by your plan. This applies to any situation where that person is covered by your plan. 2C is a code that always applies. So anybody is covered by your plan, 2C is extremely important. Now let's do an example. In the next code, code 2D. 2D applies if any situation that person is in a waiting period or in a measurement period. Let's say you hired somebody, okay, you hired somebody in the month of August, and then you have a 2-month waiting period. From January through July, you would use 2A. A 2-month waiting period would be August and September, it would be 2D, and they took your coverage, and then for the rest of the year, there would be 2C. So during 2015, there would be 3 codes that would apply in that situation for that individual. So again, if you have a lot of turnover, these codes are going to be extremely important. Now another code that's important is if you have union employees, the next code is 2E. 2E applies for any union employee that's a W-2 employee, and you contribute for that person. 2E would apply. So 1H would apply in line 14, 2E would apply in line 16. Now 2F, 2G, and 2H. These codes only apply if somebody waives your coverage. 2F is going to be the W-2 safe harbor, 2G is going to be the federal poverty line, and 2H is the rate of pay safe harbor. But these only apply if that person waived coverage. Now the last code is 2I. 2I is a non-calendar year transition relief. If you are an employer that has 100 or more employees and you have a non-calendar year plan, the law says that you have to comply. If you comply with the transitional relief, you don't have to comply until your renewal date in 2015. The instructions say that 2I generally applies only if somebody waived coverage. If somebody took your coverage, 2C always applies. Okay? 2C always applies. So let's recap, and I'll go through some examples in the next few minutes. So the important codes that you're going to use a lot are 2A. 2A applies for any month an employee was not working for you. 2C. 2C is going to be important because anyone that's covered by your plan. And for many of your employees, 2C will apply for all 12 months. Another important code is 2D. Somebody in a waiting period or in a measurement period. Another important code, if you have union employees, is going to be 2E. If you have to contribute to a union plan for your employees, 2E is going to be extremely important. Now, for anyone who waives your coverage, you can use either 2F, 2G, or 2H, and depending on what safe harbor applies and which safe harbor you're using for affordability. But you only use those codes if somebody waives coverage. And lastly, 2I applies if you have a non-calendar year plan, you have 100 or more employees, and let's say your renewal date is October of 2015. For anyone who waived coverage, you would use 2I. Okay? Anybody have any questions? All right, why don't we get any questions?
I have some here, Larry. Let me go through them because there's quite a few. Let's start with, okay, COBRA. Let's see, COBRA question. Hold on. There's a lot. All right. COBRA question regarding dependents who reach age 26 and now no longer on the parent employee's plan. If the dependent had two separate coverages during the calendar year, first covered under the parent's plan until September, then individually under COBRA until December. For the first year with two coverages, does the dependent receive a separate 1095C for the COBRA coverage, or would
yes,
they? Okay,
if they're not covered by the employer's plan or by the parent, because they're the primary person. So you would be 1G for 6 months, and then they would be covered by their parent's plan for the first 6 months.
Okay, which is what she said, 1G, and then she's okay, perfect. Okay. Next question: for an employee had been full-time for all of 2014 and therefore offered coverage for all of 2015, but then terminated employment in January 2015, if the employee was offered coverage for January 2015 but did not work more than 130 hours in that month, does the employee need a 1095-C form?
In order to get the form, they have to be full-time for a month during 2015. So if they didn't work, if they quit in the middle of 2015 and didn't work 130 hours, they don't get the form.
Okay, and then they said if the employee declined coverage in 2015, what safe harbor should be used?
It all depends which one you want to. It all depends which one the employer is using.
All right, he said the group is using W-2 safe harbor, but the employee...
It's 1F then.
Okay, the employee only worked 10 hours, making the plan unaffordable based on the W-2 safe harbor method.
Well, again, if it's January of 2015, you can you don't know what his W-2 is for the year yet. I mean, that's the problem. If they're only working for a month, I can't see how they can see it's unaffordable.
Okay. Next question, can an employer use a different line 16 safe harbor method on an individual basis?
It's by employee group.
By employee group, okay. And then what code would you use?
For example, you could use one method for hourly, another method for salaried. Or you can use one method for one location, and it's got to be divided up with employee groups, not individuals.
Okay. And then what code would you use if an employee waived coverage?
It's 2F, 2G, or 2H.
Okay. In Part 2 of our single employee cost meets the 1A status, or if Part 2 of our single employee cost meets the 1A status, can 1A code be used on employees that elected family coverage that doesn't meet the 1A cost calculation?
It's only, remember, the affordability, and it only applies to individual coverage.
Okay.
If you look at it, bear with me a second. See, the 9.5% is only based on the single coverage. If you look at 1A,
Okay. Next question. It was my understanding that an offer of COBRA coverage made to a former employee upon termination of employment is not reported as an offer of coverage on line 14. Instead, the ALE will enter code 1H, no offer of coverage, on line 14.
That's correct, but again, it's 1G, offer of coverage to employee who is not a full-time employee for any month. So again, the instructions say in that situation you use 1G.
Okay, and she said in code 2A, individual not employed on line 16.
No.
Okay.
If you look at the instructions, it's 1G, offer of coverage to an employee who was not a full-time employee for any month, and the instructions say 1G.
Okay. So Michelle, if you have further questions, why don't you put them in the questions tab, and I can reiterate them better to fit your question. Next question, what if you have a full-time eligible employee who goes contingent?
What do you mean contingent? I don't understand that, contingent.
Okay. Paul, why don't you send me a further update on that, and I'll answer that. For union employee, what do you mean about contributing to union plan?
Well, let's say you had pipe fitters, and a pipe fitter worked for you for a month, and you contributed for that pipe fitter. And the union contract requires you to make a contribution on that person's behalf. Then for that month, you would use 2E in that situation. So if employees work for you for a month and you have to contribute to the union plan, the W-2 employees, then 2E that's the code you have to use.
What safe harbor code is used for an employee who is offered coverage but declines coverage to be enrolled in his or her spouse's insurance plan?
It's 2F, 2G, or 2H.
Okay. And then question 2E would only be if employee was hired from a union hall, correct?
No, they're covered by a union plan. If you have employees that are covered by a union plan, let's say you had full-time employees covered by a union plan, and you contribute for a union plan, they don't have to be hired from a union shop if they're covered by a union plan.
Okay. We acquired a company beginning in 2015. Two of the employees were brought on as part-time consultants and offered COBRA coverage. what codes and lines would we use for them? Do we need to fill out line 15? They were
If you're
part-time.
self-insured, you would have to, again, it's 1G would have to go there if they're COBRA participants.
Okay, and then, the presentation will be, it's actually available in the handouts tab. That was a question. So it's right here on your GoToWebinar toolbar in the handouts tab. Next question, for COBRA, I understand you enter 1G on line 14, but then do you leave the other lines blank?
Yes, but it's only for the year after termination.
Okay.
And I have slides on that in the next few minutes.
Okay, and then for the question about the employee going contingent, it says works full-time, then goes to work as needed, i.e. works 8 hours 1 week, off 3 weeks, works 16 hours, etc.
And that's in that situation, if they're no longer full-time, basically what you have to do, you have to put them in a monthly measurement period, and then you have to continue to offer them coverage until they're deemed to be not full-time. You can't just terminate them willy-nilly. That's the problem.
Okay, perfect. Line 15, employee share of lowest cost. Isn't this the lowest cost of any plan offered, or the lowest cost of the plan employee selected?
No, it's the lowest cost offered.
Okay, last two. Please provide the code where it says to use 1G for COBRA participants.
It's 1G.
Okay. If employee works 2 jobs under same company but different EIN numbers, which one do you file under, or should they be filed 2 times?
No, the instructions say it's just one. For each month, you have to alternate between the 2 companies. That's what the instructions indicate.
Okay, and the next question, Q14 for retirees, does that equal 1G?
Yes.
Okay. What about Q16 for COBRA and retirees?
Q16?
Q16, she said? Maybe she meant 14. What about
have them re-ask the question.
Yeah. So go ahead and re-ask that one about the Q16 for COBRA and retirees. But, okay, so this is for the, goes full-time, then works 8 hours, or, works full-time, then goes to work as needed question. It piggybacks to that. But since they were working only 8 hours 1 week, wouldn't they be 1H and 2A?
Well, again, remember, if somebody is in a stability period, they're constantly full-time. Again, you cannot, under this new system, you cannot just make them part-time just automatically like that. That's the problem, and that's a bigger issue than for this.
Okay,
now, that's the big issue.
Okay, those are all the questions I have. If we want to go ahead and open it up to questions, or...
Yes, let's do that, and then we have to cut it short because we only have about 20 minutes left.
Right,
So I'd like to go over through the 1095.
I think a lot of people asked their questions. I had a ton, so if you want to just continue and then we can save them for the end, that's fine too.
Why don't we do that?
Okay.
So for those, now I've been talking about a limited non-assessment period. This is important. This is a period which individuals the employer is not subject to any penalty for that, and there's a number of different situations that would apply. This slide discusses all the different limited non-assessment periods, but in my experience, the 2 most important situations are waiting periods and measurement periods. But this is a complete list of all the different situations that come under that definition. Now, in Part 3, this is the covered individual. This includes the individual employee plus the spouse and children. This part will be completed for any employee who is enrolled in coverage, regardless if the employee was full-time or not. This part is completed by an employer for self-insured coverage. This includes any non-employee director or retired person who was retired the previous year, terminated employee receiving COBRA who terminated employment. All these individuals are for Form 1095-C that is used with respect to an individual who is not an employee for any month of the calendar year. And again, these are COBRA participants who haven't worked during the year, retirees, or any individual who is not an employee. You have to use 1G to report that. Now, for somebody who's terminated during the year, that's a different report. Part 3, in this part, the name and social security number of each covered person is entered. The social security number for the covered person cannot be obtained. Then you use the date of birth. For a form furnished to participants, the social security numbers does not have to be shown. It can be, but it doesn't have to be. Okay. Now, in regard to HRA coverage, if you have an integrated HRA plan along with your self-insured group health plan, what this slide is trying to say, you don't have to report the HRA separately, only if it's non-integrated. Now, employee terminated during the year and offered coverage. Month of termination, if the coverage ended before the month, you use 1G in line 14, and then in line 16, 2B. Months after termination, it'd be line 14 would be 1H, line 16 would be 2A, and the following year it'd be 1H. Spouses work for the same employer. Coverage is the name of one employee. The other is treated as a dependent. For an employee whose coverage is not the name of the and that last one is incorrect. It should be the following year. It should be 1G. I'm sorry, not 1H. It's 1G. Spouses work for the same employer. Okay. For an employee whose coverage is the name of the spouse, the Form WC will reflect only the offer of coverage and coverage to C. For the employee that's covered by dependents, the Form 1095C will reflect the offer of coverage, but it will reflect a waiver of coverage, which is 2F, 2G, or 2H. Variable hour employee becomes full-time and is offered coverage. During the measurement or administrative period, the individual is not full-time, but in a limited non-assessment period, you use 2D. If a variable hour employee is treated as full-time during the stability period, if he or she takes coverage, of course, you use 2C. So these are common situations. Another common situation is reporting for partners of more than 2% shareholders. Again, you use 2G, and reporting retirees and part-timers, again, you use 1G, and 1G in line 14. All right, since we're running out of time, we have maybe about 20 minutes left. I want to hold off any questions until the end so we can get through all the information. Form 1094C. Each separate member of a control group must file their own 1094C. So again, if you have a company with 3 different divisions, each division will file their own 1094C. So the name and address of the employer, each separate member will file their own 1094C. Lines 7 and 8, the contact person's name and telephone number is indicated. Lines 9 through 16 are only completed if the entity is a designated governmental entity, if you're filing for other governmental entities. And line 18, the total number of 1095Cs to be filed must be indicated. And then on line 19, in most situations, you're going to indicate this is an authoritative transmittal, which means you have to complete the rest of the form. One authoritative transmittal must be filed for each employer. And again, this is extreme. So each separate member of a control group must file their own authoritative transmittal. I will tell you in the next few minutes what that means. Lines 20 to 22 are completed only by the authoritative transmittal. Lines 20, you have to, again, indicate the total number. In most situations, line 18 and line 20 will be the same number. And then in line 21, you'll have to indicate whether you're a member of an aggregated ALE group. What does that mean? It means, are you a member of a control group? If you're not, say no, and you have to complete Part 3, Column D. I will indicate that in the next few minutes. If you are a member of a control group, mark yes, and then you have to complete that column. Now, what's causing everybody problems is line 22. There are 4 boxes there. Box A is a qualifying offer method. A qualifying offer method, you can only use this method if you provided a qualifying offer, which means employees did not pay more than 9.5%, 9.5.6% of the federal poverty line. So a qualifying offer is an offer to one or more full-time employees for all months during the year for which the employee was a full-time employee and which was not in a limited non-assessment period. So it's 9.56%. If you did that, you can check that box. Now, if you do that, you have to use 1A, and if you want to, you can do an alternative method of furnishing the employees a 1095-C. And instead of providing them a 1095-C, you can provide them with a statement that just indicates their name, address, EIN number, contact name, and telephone number. Statement indicating for all 12 months of the calendar year, the employee and his or her spouse and dependents receive a qualifying offer and therefore not eligible for premium credits and subsidies, and a statement directing the employee to see publication 974. Most employers are not doing that. They're just giving the employees a 1095-C. Next is the qualifying offer transition relief, which means you offered a qualifying offer for some months and not for others. In this situation, to be eligible to use this method, you have to offer coverage to 95% of the full-time employees. And if you do that, there's an alternative method. This is indicated in this column right here. You can give them a statement indicating that the employer's name, address, and telephone number, the contact name and telephone number, statement indicating that the employee and his or her spouse, if any, may be eligible for premium credits and tax credits for one or more months. The most important box is box C. Now, this is an extremely important box because of the fact, if you want any transition relief, you have to check this box. And there's two types of transition relief. One if you're between 50 to 99, and the other if you're over 100. If you don't check that box, you don't get any transition relief. I urge all of you to check the box. This is the most important box that you want to check on the 1095-C, 1094-C. Because if you don't check this transition relief, you don't get it if you're between 50 to 99. If you don't check the box, then the employer mandate you'll be subject to the employer mandate in 2015. The last box is box D, offer method. If you offer coverage to 98% of your full-time employees, their spouse and dependents, you can check this box. If you check this box, the advantage of checking this box is the fact that you don't have to, again, complete full-time employee count, Part 3, Column B. So you don't have to complete that box. Now, one thing I wanted to do, because I rushed through this is what I'm referring to. So again, I was referring to line 20, 21, and 22. These are the four boxes. Now, here is Part 3. Now, the first column is minimal essential coverage offer indicator. You answer yes or no. And the question they're asking is, did you offer coverage to 70% of your employees, full-time employees? If you answer yes, there's no penalty. If you answer no, there'll be a penalty. If you're between 50 to 99, you always have to answer yes. If you're 100 or more, you answer yes if you offered coverage to 70% of your employees. Column B, you have to put the full-time count of employees. So for each month, the number of full-timers. And again, if you checked box D, you don't have to, again, put that number in there. Column C, total employee count. All your employees. And again, with the full-time count, you have to put in anyone in a waiting period or in a measurement period. Column D, aggregate group indicator. Were you part of a control group? If you were, you have to check the box. And what's important is the most important column in the 1095-C is the last one. This is where you indicate that transition relief applied to you. If between 59.99, you put column A. If you're over 100, you put code B. And lastly, if you're a member of a control group, you have to put all members of the control group in Part 4. Okay? So again, talked about the 98% method. In column A, column A of Part 3, you answer yes if you provided coverage of 70%. Column B, full-time employee count, you indicate all full-timers for each month. You don't include those in a waiting or measurement period. Column C, you have to, again, indicate the total number of employees. And as this slide indicates, you have 5 choices of indicating for what day of the month you're going to indicate your total number of employee count. Column D is the aggregate group indicator. If you're a member of a control group. Column E, again, code A if you're between 50 to 99. And again, code B if you're 100 or more. And again, if you don't indicate that, you don't get the transitional relief. And again, in Part 4, you indicate each member of the control group. Now, you ask yourself, suppose I don't file this or I get it wrong, what are the penalties? As I indicated before in previous seminars, it's $250 per return if it's incomplete or inaccurate. Another $250 if you don't provide it accurately to the employee. So the penalty could be $500 per return. But again, the penalties are going to be waived if you can demonstrate a good faith effort. So for 2015, they're going to again allow you not to be penalized if you can show good faith effort. They haven't defined that yet. Now, what information has to be collected? For each employee, to complete the 1095-C, this is all the information you have to collect. All the information. So the employment dates for each employee, the months during 2015 which the employee was full-time or part-time, months during 2015 which the employee was subject to a waiting or measurement period, months in 2015 which the employee was offered minimal essential coverage, months in 2015 which were covered by minimal essential coverage, months in 2015 which minimal essential coverage was offered to the spouse and dependents. If you're an employee, waive coverage, the affordability safe harbor, and for each month the amount of the employee contribution and the names and social security numbers of members of the family. This is all the employer information, members of the control group, the names of each members, the total number of full-time employees, the total number of all employees. Does any transition relief apply in 2015? And for what months you offered coverage at least 70%. This is all has to be provided. Let's look at any questions.
Okay, I have a few, but not many, so I will go ahead and do those.
You couldn't mute people?
Oh, you know what? Something is really wrong. I've never had this. It was like I had to manually do it through the codes on the phone, through my little card. So I apologize to everyone. You guys were so good. Thank you so much for bearing with us here. I will certainly call and figure it out for next time. Okay, are employers reporting on data from 2014 or 2015 for the upcoming deadlines?
It's information for 2015. It's the information for calendar year 2015.
So it's for 2015. Okay.
But you determine whether you're an ALE in 2014. But whether you're a large employer is determined in 2014.
Okay. Do we have to provide forms to retirees who have Medicare as their primary?
If they're covered by your plan, you must give them a 1095-C.
Okay. For an employer who has a non-calendar year plan and qualifies for safe harbor relief for non-calendar year plans, would 2I be used for all months in 2015 prior to start of 2015 plan?
Only for those who waived.
Okay. So this says, for example, July 1 plan year start 2I is used for January through June?
Only for those who waived, because if somebody took coverage, 2C trumps everything.
Okay. If there's an employee who terminates during the year and then takes COBRA, what code would be used for the period that they took COBRA?
It'd be 1H and 2A.
Okay. Would you ever use code 1H for a COBRA enrollee?
Yes. For the year of termination, you'd 1H and 2A.
Okay. What happens with employees who terminate during the plan year? Are they receiving a regular form like those offered to active, or are they considered non-employees?
They would get a form just like everybody else, but you would indicate in those ones that it didn't work.
Okay. If a person doesn't elect COBRA, do you have to complete the form for them after they are not active as they don't elect COBRA?
1H and 2A.
Okay. This PowerPoint for everyone is available in the handouts tab. It was recorded and it will be available on our website. I sent it to you all, or you could just go to benefitexpress.info and search for archived webinars. Just a couple more questions. Can only one box be checked in line 22?
No, as many as apply.
Okay. Please explain process when one ALE reports all EES for a controlled group.
Could you repeat the question?
Yes. Please explain process when one ALE reports all EEs for a controlled group.
They don't do it. Each separate member has to report separately.
Okay. Under the first slide of common situations, can you go over again what codes to use as you went really fast and then seemed to correct some of the information that was on the slide?
Okay. As you can see, this is very complicated. And I've been working on this a year or so. Now, let's go back to the forms. Okay. Here are the important codes in line 14. Important codes if employees pay less than $93 a month for single coverage, you can use 1A. Another important code is 1E if you offer coverage to the entire family. If you don't offer coverage to the entire family, but you want to be compliant with ACA, then another important code is 1C. Now, 1G is very important for those if you cover individuals who are not employees, COBRA participants, retirees. That's an extremely important code. Another important code is 1H. That's used for, again, the year of termination of an employee. 1H is extremely important. And line 16, important codes that you'll use. 2A for any month that person was not working for you. Another important code is going to be 2C. Anyone covered by your plan, that trumps everything else, 2C. 2D is extremely important because that is for anybody in a waiting period or in a measurement period. 2E, if you have any union employees are covered by a multi-employer plan and you contribute for them. So if you employ union workers and are covered by the union plan, 2A is going to be real important. 2F, 2G, and 2H are very important because they apply if somebody waives coverage and you have to pick which safe harbor you're going to use. Another important code is 2I. 2I is extremely important because if you have a non-calendar year plan, And for those who wage, instead of using 2F, 2G, or 2H, you use 2I. All right. Anybody have any questions?
I just have a few more. Let me get through these. Part 3, 1094C, can you explain column C again?
Sure. Let's go through column C again. Column C is the total number of employees, and you can pick a date. There's 5 different choices. You pick a date of all employees for each month. Now compare that with column B, which is the full-time employees. So it doesn't take a brain surgeon to realize these numbers are going to be real important, because the IRS is going to use these numbers to determine whether you're in compliance. So that's why these numbers are extremely important. So again, column B is just your full-timers, so it doesn't include anybody in a waiting period or in a measurement period. Total number of employees is everyone that works for you, every employee. Column D is if you're in a control group, and if you check the box in column D, then you have to complete part 4. Another important column is column E, because that's where you indicate whether any of the transition relief applies to you. So again, those the 1095C is very important, because it is for whether you're going to be penalized. Okay. Any other questions?
I have a couple here. We offer an HRA to Medicare-eligible retirees. These retirees have enrolled in a medical plan through a private exchange. Are we required to provide a 1095C?
Could you repeat the question again?
Yes. We offer an HRA to Medicare-eligible retirees. These retirees have enrolled in a medical plan through a private exchange. Are we required?
You would have to give it, yes, you would have to, because it's not integrated.
Okay. And then next, is it correct if we use 1G that we do not complete line 15?
That's correct.
Okay. And then this, she says, I hate to keep asking about COBRA, but I feel like sometimes Larry says 1G and then nothing else, and other times
No, because it depends. It depends if it's a year of termination. If it's a year of termination, then 1G doesn't apply. Then it's 1H and 2A, and the year after termination, it's something else.
Okay. Okay. And
that's
then,
the reason for the difference. I apologize if I wasn't clear.
Okay. If line 14 is 1H when employee separates, doesn't line 16 have to indicate 2B for COBRA offerage, then 2A after?
No. 2B is only in a month in which that person terminates the coverage was ended before the end of the month. That's what 2B comes in.
Okay, and last question, do we count part-time employees in column C if not on your insurance?
It says total number of employees, so it's all employees.
Okay, perfect. That's all I have. If anyone has any they want to ask.
This is Lynetta again from CPS. I just want to make sure I'm using the right number. So, for an example, if we take the lowest paid person, say it's $20,000 a year, times the 9.56, and we divide that by 12, correct?
Yes.
So,
for the year, it would be the monthly figure for it would be the monthly figure for each month.
Right. So if I'm taking 9.5% of 20,000, and then that's 1912, but I have to divide it by 12 to get the monthly, right?
It's monthly reporting.
And it comes out to $159.33. But I thought you said something about $90 is the most.
Well, because it's 9.5%. To do 1A, it's going to be based on 11,770. To use
that's 11,770 is a year, right?
It's for a year. That's to use the federal poverty line.
Okay.
Okay. Now, if you want to use some other method, for example, either W-2 or rate of pay, you can do it that way.
Well, the easiest way for us is going to have to be the 9.5% because we have too many employees. We have over 38,000 employees.
I understand.
So we can't do it one by one.
Right.
Yeah. So we'll use the 9.56% then.
Okay.
Okay. Thank you.
Any other questions?
I got one more. When is code 1H used?
Code 1H is used if there's no offer of coverage.
Okay, perfect. Thank you, Larry.
All right, take care, everyone.
Thank you, everyone, for being patient. I will find out what happened with that and
Okay,
make sure
bye-bye.
it doesn't happen again. Thanks, everyone.